We are extremely excited because it's the first DAT-ICU organized by the APHP. This very old project is now concrete, and for the first time people will use the MIMIC open datasets thanks to the APHP Healthcare Data Warehouse.
So today it's the inauguration of our analytical platform. It will support many research projects in the future.
The French Intensive Care Society is very proud to co-organize this first DAT-ICU. This Datathon, based on the MIMIC database, put together during a weekend 200 researchers. These 200 researchers will try to answer important questions for ICU patients, meaning they will try to find with this existing data if we will be able to make a better diagnosis for this patient, or maybe to predict the prognosis of this very severe patient of the ICU.
I find it really interesting because there's people here from the private sector, from companies, from the academy, from government-funded institutions. Like I worked with the CNRS for many years.
Yeah, the questions about what kind of algorithms are the best to use, what kind of approaches have been tried in the past, what has failed in the hospital setting, what kind of questions do the intensivists, the ICU doctors, what are they dealing with? Those are things that engineers don't necessarily deal with on a regular basis.
Patients in intensive care units generate enormous quantities of data. That data contains important information which, if you put it all together into a database, makes possible research that can answer important questions that ultimately benefit patient care.
So the medical doctors have proposed some subject a few weeks ago, and we have built some teams with all the skills needed for each project. And now it's a starting point, and we hope we will have some good results tomorrow.
So we have high expectations and they have a high degree of realism. So we just need to match both.
I think the patients are going to be the real winner on the day.
At Paris Hospitals, we believe in innovation, and we know that data is a key for innovation.
I'm not an expert in medical data, but what's specifically interesting here in this hackathon is that I have the opportunity to work with clinicians and doctors who have this knowledge with these very complex databases.
Each one in the team is actually following a different part of the project, so that when we finalize, we hope to parallelize everything, and so in the end the results would be actually better because everyone is doing something different and using the best part of their skills. It seems that it's working, so let's see.
Definitely there is that magic as well, that there is that excitement that is happening, and we're hoping to see the results during the presentations tomorrow.
I think definitely every time I come to these events, I end up seeing a lot of things that I didn't realize existed, even in the research literature. So different techniques being applied to different clinical problems. And then here, it was also really interesting because it's a data set that I think generally I'm pretty familiar with. But even given that pretext, folks were using it for purposes I haven't actually really seen before, and getting some pretty interesting results.
Research hypotheses are emerging. Some of them will be consolidated through IRB-authorized studies running this time on APHP data.
So in some ways, I think our experience is unusually easy, but I would hope that our experience can be modeled elsewhere in the world. And I'm happy to hear and see that actually that's happening in some countries, maybe even in France, right? Because you have such rich resources here.
It's the end of our 2 working days. The 20 teams build a very nice project. These projects are extremely different. Some of them focus on diagnosis, some others prognosis. Some projects try to find out some information from the text, from the structured data, unstructured data, and it's the occasion to create a very strong collaboration.
I think the data was the real leader. We had the opportunity to prove some general concept that machine learning could learn on a restricted data set of healthcare data. And we would like to do that again on the database of the Public Hospital of Paris.
We are well coordinated during all the hackathon, so everyone has his thing to do, and we help each other, and all goes well.
We mostly learned about open source tools that we don't normally use. So it was a big eye-opener to try open source tools and OMAP data structure and Mimic.
We've worked hard to integrate the data from the different ICU software. Now, this Datathon was about reanimation, but there are plenty of interesting topics. And we have data about biology, about imaging, and about medical reports. So we invite physicians and data scientists to write projects to work on the APHP clinical data warehouse.
Thank you so much, everybody. That was a great weekend. Please stay connected to each other, keep on working together, and keep on producing. Thanks a lot.